Hi, I'm Tamsin Stafford, Partner Manager here at GS1 UK, and joining me today is Natasha Smith, Marketing Manager at GS1 UK. And we're going to give you an introduction to who GS1 UK is, our purpose, our mission, and also touch on the fantastic healthcare conference we have happening this April. So, firstly, who is GS1? Well, GS1 is a not-for-profit neutral organisation. We are global. So there's actually 118 local member organisations around the world. So nearly where there's a country, there's a GS1. Now, what we do is we operate standards and also our members, and we work with our members to help them solve industry problems that they can't solve themselves. So one of the biggest ways people know us is through the barcodes, and there are actually 10 billion GS1 barcodes scanned daily. These are on more than 2 million companies all using GS1 standards, and actually more than 100 million products use GS1 barcodes. So absolutely everything that we do is built on standards, and those standards are all around using a common business language to help interoperability across the supply chain, and this is especially within healthcare. So those standards are related to these three pillars. Firstly, identify, which is super important because it's all about the unique identification of every person, product, place, and asset. And then also it's a case of how you capture that information and how you share that information. So our healthcare mission is to work with healthcare providers, suppliers, and solution providers, ultimately so important to improve patient safety. But on top of that, we help reduce unwarranted clinical variation, and we help drive operational efficiencies. So by working collaboratively with stakeholders, we help the NHS save thousands of lives and millions of pounds.
So in terms of our stakeholders, we work with healthcare suppliers, solution providers, and healthcare organisations across the UK. So from a healthcare supplier perspective, we work to support them and make sure that their products and devices or assets can be uniquely identified using GS1 standards, and that then supports improved product traceability throughout the supply chain and right the way through to the patient at the point of care. Working with solution providers to ensure that their systems and products can use and capture GS1 standards so that they can be shared seamlessly between systems and organisations to improve interoperability, and working with healthcare organisations such as provider hospitals and private hospitals to implement Scan for Safety and GS1 standards to improve patient safety, reduce unwarranted clinical variation, and drive operational efficiencies across the NHS. And together, this helps to drive safer, smarter, more connected care. So how do we do that? We do that through that unique identification, using GS1 standards to uniquely identify every person, every product, and every place. But what does that look like in a clinical setting? So take, for example, a theatre setting in a hospital. Using GS1 standards, you can trace and track everything that's happened within that particular procedure. So for example, positively identifying the patient using a GS1 compliant patient wristband, the staff using GS1 identifiers on their staff badges, products, so anything that is implanted or any medicines that are administered, and tracking the location. So it's possible to build a picture of everything that's happened in that procedure right the way through from the beginning through to the end. At each touch point, the product barcode or the patient or staff barcode, location barcode is scanned, and that whole process is called Scan for Safety. So back in 2016, 6 hospitals within England were tasked with implementing GS1 standards, but now today, several trusts in England are actually implementing Scan for Safety, with national programmes also now launched in Scotland and Wales, and Northern Ireland are working to introduce asset tracking nationally as well. And some of the highlight results from that Scan for Safety programme, just in those 2 years alone, those 6 hospitals were able to improve That just went. I'm so
Oh,
sorry.
that's okay. You were doing
Oh
really
my
well.
God, I was on a roll.
You were on a roll.
I might actually see if I can edit it and not have to go through that bit again.
Whatever is easiest, I really don't mind.
Okay. In across those 6 hospitals, 140,000 hours of clinical time were released back to patient care. 9 million worth of non-recurrent inventory savings and £5 million worth of recurrent inventory savings across the 6 trusts. You could just imagine the scale of what that would look like, what that picture would look like across all hospitals across the UK. And the use cases are not just restricted to clinical settings. There are several use cases and applications of GS1 standards adoption and Scan for Safety across the NHS, including asset management, milk tracking, blood tracking, and live bed state, helping to manage patient flow. And we're going to bring all of these case studies and use cases to life at our conference.
That's exactly right. So what we're going to do at the GS1 UK Healthcare Conference 2025 is bring all those use cases to life to really shout about the benefits of Scan for Safety for patient safety and other benefits. So looking at the details, it will be a 2-day conference and exhibition on the 29th and 30th of April 2025. The location is at the QE2 London Westminster. For those of you who came to our last events, it was the same one last year and we had really positive feedback. And it's going to be a great opportunity to meet with like-minded individuals, such as, more than 500 attendees, over 50 speakers, and more than 40 fantastic sponsors and exhibitors. And of course, no event is complete without a good bit of networking. So we've put on a few special events. So at the end of day 1, there'll be an evening drinks reception at the QE2 using the exhibition hall space in the Britain. So this will be open to all delegates and partners. And at the end of day 2, there'll be a buffet afternoon tea at the House of Lords. So super special location. This is exclusive for 2-day ticket holders only, and also those in the NHS, public sector members and key sponsors.
So what can you expect to hear about on the agenda? So as we talked about those key Scan for Safety principles, the unique identification of every person, product and place, and how that applies throughout the process. So the programme will really pick up and hone in on those 4 key pillars, and they'll run as themes throughout the event. So we've got patient safety and interoperability, product traceability and sustainability, location identification and efficiency, and engagement and implementation. And it's the engagement and implementation side that's particularly interesting for our 2025 event, because we'll have small focus interactive discussion groups with about 10 to 12 people where you can really get into the detail of some of those key topics. So what can you expect from the agenda? We'll be covering key topics such as using point of care scanning to reduce never events, the NHS supply chain inventory management and point of care scanning rollout, the new hospitals programme, and how GS1 standards could be used throughout that process to improve traceability across the NHS estate, and the Department of Health and Social Care's MedTech strategy and the use of GS1 standards to support that. And this is just a snapshot of some of our key speakers that will be attending. We're going to have over 40 to 50 speakers already planned to join us on the agenda, including Dr. Henrietta Hughes, who's the Patient Safety Commissioner for England. We've got Sarah Ford, Executive Director at NHS Supply Chain, Alison Cave, Chief Safety Officer, the Medicines and Healthcare Products Regulatory Agency, and David Lawson, Medical Director of Innovation at the Department of Health and Social Care.
So we gave you a little idea of the numbers of people in the room, but actually let's look at who is going to be in the room. So many fantastic stakeholders. So for example, we'll have national leaders and organisations like government, the Department of Health and Social Care, the Medicines and Healthcare Products Regulatory Agency. We'll also have NHS England, NHS Supply Chain, the Health and Services Safety Investigation Body, and the Care Quality Commission. We'll have NHS and public sectors, so healthcare providers. These are mainly acute trusts across the UK, Royal colleges, as well as think tanks, research and academia bodies. So lots of people looking for fresh insights. Then we'll also have GS1 members and non-members. This can be medical device suppliers and manufacturers, pharma suppliers and manufacturers, as well as distributors. And last but not least, we'll have a great selection of solution providers. So organisations that supply equipment and systems to the NHS. So why sponsor or exhibit? Well, we've already given you a flavour of why it's going to be such a great couple of days. But ultimately, it's a really fantastic opportunity to network with more than 350 healthcare, regulatory and government professionals who are really all looking for that common sort of goal in terms of scan for safety. So you'll be able to look at new insights, understand what's coming next in industry, and ultimately influence your business development in line with the bigger picture. So if you'd like to get involved, we'd love to see you there. So of course, there's opportunities to exhibit, to sponsor, and also to take out those interactive discussion groups that Natasha mentioned earlier. So if you'd like further information, we are working with our fantastic event agency, BIP Solutions, who are organising the specs packages. So please do get in touch with GS1 Exhibitions at bipsolutions.com, or you can call them on the phone number there. And of course, if you'd like to find out more about GS1 or partnerships, then please email partnerships@gs1uk.org. And if you'd like to register to attend, then please do secure your tickets on the link below. This is going to be a great event. Obviously, get your tickets early. And for further information, you can see the website on the link there, and also you can find extra resources on the link there. If you check out the website, you'll also find the action-packed agenda, the list of speakers, and so on. Thank you so much.